Hi, I'm Becca Reich, guest editor of the special topic issue Overactive Bladder and Beyond, Unraveling Bladder Pain and Dysfunction. Do you ever feel like the more you learn, the less that you truly know? I remember the confidence I had in treating my patients with overactive bladder after my first women's health continuing education class almost 25 years ago. Just teach them quick flicks and distraction and fix their fluid intake, right? And honestly, using that approach, most of my patients got better. But once I started to research overactive bladder, I realized how complex the pathophysiology and the treatment could be and how much was still unknown. Since then, my research interests have focused on overactive bladder, and while I've learned a lot, I recognize how much we still don't know about this condition. This special issue includes an interesting mix of manuscripts that both teach us new things and expose what we don't yet know. It starts with a clinical commentary about the history of our understanding of urinary urgency, the key symptom of overactive bladder, by Dr. Rebecca Doss. This commentary highlights how so much of what we know or think we know about OAB has changed over the years. The issue then moves into several papers that explore interesting connections between bladder symptoms and neurological conditions that we might not readily associate with patients seeking treatment for OAB in a typical outpatient orthopedic pelvic health setting. Conditions such as benign paroxysmal positional vertigo, Parkinson's disease, and multiple sclerosis. The beauty and the challenge of exploratory research papers like these is that while they show us that certain things might be related, those relationships subsequently expose more of what we don't know. In other words, we now know this relationship exists, but what do we do about it? By exposing those questions, these types of studies provide a great starting point, for what studies we might do next. What's the next thing in the research agenda for OAB? In light of all that we don't know, how do we provide the best care for our patients with OAB? To paraphrase Dr. Doss, the best we can do as PTs is to thoroughly assess the aspects of the musculoskeletal system that could feasibly influence the experience of urgency or urgency UI, and then address as many of those contributing factors as possible in the best way that we can. And in doing our best, we need to keep in mind that we might eventually learn more and then do better. Dr. Trojanowski et al.'s paper in this special issue about the know-do gap and the knowledge to action cycle describes a way that we can assess the gap between the recommendations for best practice and current actual practice. While Dr. Trojanowski writes about treating patients with Parkinson's disease, the know-do gap that she talks about is also exposed in Dr. Swank et al.'s paper on electrical stimulation for OAB. These authors note that E-stim is part of best practice according to a recent clinical practice guideline on OAB published by this journal, yet their research indicates that PTs are not consistently using this modality. Finally, Dr. Stifler et al. Makes a case for using the evidence we have about a certain group of patients, cisgender women in particular, and effectively adapting those to patient care situations for which we don't yet have a wide body of published evidence, transgender men specifically. As much as we already know about OAB, we'll continue to learn more as new evidence emerges. All the authors in this special issue provide excellent recommendations for future research, and I'm confident that we'll see more manuscripts on OAB and beyond in upcoming issues of the Journal of Women's and Pelvic Health Physical Therapy. I really hope you enjoy these papers.